The affordability of healthcare is another issue drawing fierce debates across America. According to Gallup, in 2019, 33% Americans said they or their family put off treatment for a medical condition due to high costs, and 25% said they delayed looking into a serious condition. The rate of postponing medical care was the highest in the past 20 years. Meantime, a report by RX Saving Solutions said the prices of 3,400 types of prescription drugs went up by 10% from the year before, 5 times the rate of inflation.
That one to see
These Americans are traveling 1,300 kilometers north in a caravan from the U.S. state of Minnesota to Ontario, Canada. Their goal? To buy insulin at a tenth of the price it would cost in their own country. The drug is a lifesaver for those suffering from type 1 diabetes.
Woo! It is staggering how much more money it is in America. You can see why 1 in 4 Americans are rationing their insulin because they can't afford it. We are from a wealthy country. We are from a great country. But we are not taking care of our citizens.
This retails for around $300 for 1 vial, and I just got it for 25 US dollars here. Now, why the hell is that? Why? It's crazy to me. So I am as excited as I am to save some money. I'm devastated to know that affordable insulin is just available to us across the border.
There is also anger that people continue to die from diabetes because they couldn't afford proper treatment.
I am up here demanding justice for his death.
Nicole Smithholt lost her son, Alec, in 2017. He was rationing insulin because of the expense.
Here we are talking about how even though there is a treatment for type 1 diabetes, my own son didn't benefit from that treatment because he couldn't afford it. It's difficult. It's a hard pill to swallow.
The American Journal of Public Health suggests health issues have led to 2/3 of bankruptcies in the U.S. Its report looked at 1,000 cases between 2013 and 2016, and it found a majority of those who had trouble paying medical bills were middle-class Americans who had health insurance. And to speak nothing of those without health insurance, a Gallup report says between 2016 and 2018, 7 million Americans lost their medical insurance. 21% under the age of 35 were uninsured. Healthcare, or the lack of it, has become a key factor that divides the rich and the poor. The U.S. Census Bureau says the income gap is at its largest in 50 years. It's measured through the Gini Index, with 0 representing total equality and 1 representing total inequality. In 1967, the Gini Index was 0.397. In 2018, it climbed to 0.485. By comparison, no European nation had a score greater than 0.38. In 2018, the top 10% of U.S. households controlled 70% of all wealth, up from 60% in 1989. While the share controlled by the top 1% of wealthy Americans went from about 1/5 to nearly 1/3. Those at the bottom half of the wealth distribution saw virtually no increase in their nominal net worth over the last 30 years, while their total share of national wealth dropped from 4% to just 1%. And as we speak, a potentially record-setting amount of money is being poured into the 2020 presidential election campaigns by the wealthy donors and powerful political forces. This, while the 500,000 homeless are without a roof above their heads every night, and 4 in 5 working-class Americans are living from paycheck to paycheck.